listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, at some point you may be in a situation where a client has a grievance about you or their coverage. It's important to be equipped to handle these situations as they arise. Medicare grievances and how insurance agents can try to prevent them, written by Emily Markovic. Many are familiar with today's derogatory expression of being a Karen, which put simply entails making complaints and demanding desired results. While receiving fries instead of onion rings at a fast food restaurant might not require a complaint to the government, issues involving the purchase and use of Medicare or other health insurance coverage is a different story. It's true you can't make everyone happy, but your job as an insurance agent is to sell quality coverage and do everything in your power to eliminate cause for clients' dissatisfaction with their sales experience and health coverage. You don't want to have a Medicare grievance filed against you. Let's examine the basics of these grievances so you're prepared to prevent them from occurring. What is a Medicare grievance? When a client has concerns about the quality of care or other services received from a Medicare provider, they can file a grievance, also referred to as a complaint. These issues can be in relation to a doctor, hospital, provider, health plan, drug plan, quality of care, dialysis, kidney transplant care, or durable medical equipment. While these issues may not have anything to do with you directly, as your client's main point of contact concerning their healthcare coverage, they may come to you for help and support. How Medicare complaints are filed depends on the problem at hand, which is why it's important to have, at the very least, a basic understanding of grievances and how to handle them. Should something arise, you can assist your clients throughout the process. Medicare.gov is a great resource to use when clients are looking for proper direction. Before getting deeper into the topic, let's look at a few statistics for Medicare complaints. Data collected by the National Association of Insurance Commissioners, NAIC, reveals that the number of closed complaints by coverage type for 2024 and 2025. 2025 numbers are as of November 18th, 2025. So far, there have been 56 Medicare Advantage closed complaints in 2025, compared to 66 for the entirety of 2024. Medicare prescription drug plans have one closed case for this year, compared to 4 closed cases in the span of 2024. Medicare supplement plans in general have had 322 closed cases so far in 2025, compared to the same amount for the entirety of 2024. For more granular data on those MedSup complaints by plan type, you can visit the text version of this episode, linked in the episode notes. Moving forward, is a Medicare appeal a grievance? Medicare appeals do deal with beneficiaries' issues. However, appeals regard disagreements with a payment or coverage decision made by Medicare or your client's Medicare plans. Examples of reasons for appeals include a plan denying a healthcare service, supply, item, or a drug a beneficiary thinks Medicare should cover, a bill for a healthcare service, supply, item, or drug a beneficiary already received, or a request to change the amount to be paid for a beneficiary's healthcare service, supply, item, or drug. A beneficiary may also appeal if their coverage stops providing or paying for all or part of a healthcare service, supply, item, or drug they think they still need, or an at-risk determination made under a drug management program that limits access to coverage for frequently abused drugs like opioids and benzodiazepines. Can grievances be filed against insurance agents? Grievances don't exclude insurance agents. There's a reason for annual certification training and compliance rules. Some complaint allegations made against agents can include contacting issues like cherry picking or failing to collect permission to contact, illicit activities such as signing a form for a client or paying for referrals, deceitful interaction with clients, including misrepresenting oneself or sales materials, inappropriate or incorrect operational behavior, like poor hygiene or failing to submit an application, issues with plan and product knowledge, like presenting inaccurate plan coverage information, and negligence, including failure to enroll their client into a plan that adequately meets their needs. And just like every other action, there are consequences of grievances against agents. What happens if a grievance is filed against an agent and is proven depends on the state and insurance carrier involved. Each state's insurance bureau has their own system for filing complaints, so the processing times and outcomes could differ. Similarly, insurance carriers also have their own protocol for grievances filed against agents. Depending on the allegation and final determination, some of the consequences agents could face from the carrier can include applicable remediation, mandatory trainings, evaluations, shadowing, a formal record of the complaint, or termination of the contract. It's also very likely that the carrier will reach out for a response from the agent and any related documentation on the client, such as a scope of appointment, SOA. Now that we covered the basics of Medicare grievances, let's go over to 4 best practices for preventing them. There is no way to fully prevent grievances, but you shouldn't have to worry about them if you're the honest, helpful, and compliant agent we believe you are. Sometimes things happen out of our control, but you can follow certain best practices in an effort to do everything you can to prevent complaints about you. The first is collect scopes of appointment. We've mentioned the importance of SOAs many times here on the podcast. They're an essential compliance element that protects you and gives your client control of the conversation. Should a complaint be made stating you didn't review something properly or at all with a client, an accurate SOA can be extremely useful documentation. Make SOA collection easier by using Integrity's PlanEnroll Client Sync. This feature allows your clients to create a consumer PlanEnroll profile where they can seamlessly and securely complete an SOA. You can learn more about IntegrityCONNECT and its industry-leading features by visiting the link in the episode notes. Number 2, follow guidelines set by CMS. Make sure you are following all Medicare compliance guidelines from CMS to a T, including the final rule guidelines for contract year 2026. If you plan on holding a Medicare educational or sales event before or during the annual enrollment period, AHIP, it is imperative that you're aware of what you can and cannot do. You also have to be cognizant of what you say during sales appointments. Sometimes you may say something innocently if you're caught up in a conversation or getting excited about the prospect of a sale. But innocent in nature or not, saying the wrong thing can lead to a complaint. We have some episodes on how to stay compliant during Medicare educational and sales events. You can find them in the reference section of the notes. We understand there are many rules from CMS you need to follow, The field marketing organization that powers this podcast, Ritter Insurance Marketing, must also adhere to being compliant. New guidelines are continuously being implemented, and keeping everything straight is a job in and of itself. This is where a partnership with Ritter can be extremely helpful. We can keep you up to date on the latest happenings within Medicare compliance and even provide tools and solutions to make staying compliant easy. Number 3, use reliable sales tools and data. One reason for a complaint could be misquoted premiums. This could occur from using sales resources with out-of-date data. For this reason, it's important to use plan quoting tools you can trust, like IntegrityCONNECT, PlanEnroll, and Market Advisor. Ritter's partner, Integrity's IntegrityCONNECT, and PlanEnroll platforms make the Medicare enrollment process simple. You or your clients, respectively, can simply enter a zip code to compare top-rated plans in their area. Something to note, agents should use IntegrityCONNECT to quote, compare, and enroll clients into plans, while consumers should use PlanEnroll to quote, compare, and enroll directly into plans. Market Advisor is powered by another esteemed Integrity partner, CSG Actuarial, and enables quoting and comparison of MedSups and ancillary products and online Medicare supplement enrollments. You can gain access to these quoting tools and Integrity's technology platform by registering with Ritter first and then completing the quick and easy sign-up for IntegrityCONNECT. All the links to learn more are in the notes. Number 4, don't just sell to make a sale. Keep in mind the quality of sales is better than the quantity. A great agent knows when it's more important to admit that they may not have the best product to meet a client's needs in their portfolio. Is it a bummer? Of course, but it's a chance to prove what kind of agent you are and a learning opportunity for your next sale and AHIP. This will also go a long way in preventing appeals against the Medicare plans you're offering. If a plan is truly the right fit for your client, there's less of a chance the services or prescriptions they need won't be covered. Someday you may find yourself in a situation where a client reaches out to you wanting to file a complaint or appeal. If this happens, be sure to listen to their issues and concerns and offer to support them through the process. We certainly hope you'll never be in the position where a grievance has been filed against you. However, if you follow compliance guidelines and put your clients first, the chance of that happening decreases. Thank you for listening. We will see you in next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an Integrity company. This episode was written by Emily Markovic, script proofing by Sarah Ruppel, recording and production by me, Tina Lamoureux, podcast design by Urban Rivera. Follow along with our show wherever you like to listen.